Hi friend, in our last video we finished by talking about finding ways to take care of yourself and ways to make your surroundings pleasant and comfortable. How are you feeling, and do you have any questions for us? Some people are in shock and can't even believe what is happening. Others are afraid of what might happen to them and their loved ones. Some may even feel angry that this is happening to them and have a lot of anxiety. Others do not even want to think or talk about any of this. All of those feelings are completely normal, and it's okay to go back and forth between these feelings. On top of that, just feeling sick and being in pain makes it so much worse. But it's important to talk to someone about these feelings. Although we may not like thinking about sad things, thinking about them can help you feel better. Some people may encourage you to only be positive and may not want to hear what you're really thinking or feeling. But it's important to find someone that you can be honest with and talk to. This may be a loved one, a friend, a spiritual leader, or a professional counselor. You can talk to your community health worker about finding someone. If you can't think of anyone, you can also connect to others going through similar situations as you by joining a support group. If you're not ready to talk about these hard things, it is okay to wait a while. But it's important to set a time and a place when you will talk to someone about it. In the meantime, you may want to write down or record some of the things you want to share when you're ready. There are also simple things you can do that will help you feel better because every little thing helps, right? For instance, you can make the place where you spend most of your time pleasant by doing things like, what is your favorite music? You should play it. Do you have favorite memories, pictures, or quotes that inspire you? Put them up so you can see them. You can take care of plants or add new ones to your home. You can spend time with your pets, light a candle, or diffuse an oil that you enjoy. Or just keep a good book or an audiobook nearby and read as much as you feel like you would like. Because sometimes reading even a few pages helps. Other things that you can do to help you relax can be doing arts or crafts, spending times outdoors, writing down or recording your thoughts and ideas, or just getting enough rest. Sometimes stress and anxiety can be too much to handle, and you need to do something more. Some ways to manage your stress and anxiety are deep breathing exercises. An example of this is the 4x4. Breathe in while counting to 4, hold it in for 4, and then breathe out for 4. Let's try it together. Remember to count in your head, but I'll count out loud for you. Okay? Breathe in. 1, 2, 3, 4. You hold it. 1, 2, 3, 4. And let's exhale. 1, 2, 3, and 4. Another exercise is to refocus your attention. So touch the surface of a table, a chair, a sofa, or a bed, or lean and press against the wall. Concentrate on just doing this. Notice the texture. Is it hard, soft, rough, cold, or warm? Take time to really think about what you're sensing. Put your focus on your senses. Sometimes you also need something to distract you from the pain. Some ways you can do this is to look for 5 different colors around you. For example, around me, there's brown, red, green, blue, even purple, white, and black as well. You can touch 4 different things. Touching here my chair, and I'm really noticing the texture, the temperature. I can even touch the floor. Just really focus on it. See how there's carpet down here. Feel the texture. Try to find and listen for 3 different things. Sounds like music, the clock ticking, voices, or even cars out in the distance. Then try to find 2 different smells. And the last thing you can do is taste and think about what it tastes and feels like. This is the 5, 4, 3, 2, 1 technique. And it's easy to do anywhere and anytime. If you want more tools, talk to your community health worker. They have many things they can share with you. Even after you've implemented those things, you may feel you need more help managing your stress and or emotions because they're too much for you to handle. It's important to look for help as early as possible. There are support groups where you can meet other people who are going through the exact same things as you and are also trying to process their emotions. But it can also be helpful to talk to someone on one-on-one who is an expert in these things. Getting the help you need early on can help you better manage the cancer and respond to treatment. Be honest with your care team about how you feel, and don't be afraid to ask for more information. This will allow your care team to better understand you and give you the care you need. Because there's a lot going on and you may not have as much energy, it's important to also choose who you want to spend your time with. Find people who support you and bring you good energy. People who are willing to listen to you and have meaningful conversations with you. You know who they are, because after you spend time with them, you feel much better and not worse. Although it's healthy to spend time with other people, sometimes you may also need time to spend some time alone, and that's okay. There's a lot of people around, including doctors and nurses, and it's okay to take some time for yourself. But don't get stuck by yourself for too long, and find the balance that works for you. As much as you're doing for your physical and mental well-being, don't forget about your spiritual needs as well. Because you're going through this tough experience, you might find your faith tested. So it is important to be intentional about this if this is an important part of your life. If so, dedicate time to reflect on your beliefs and your values. Find 3 to 5 things you are grateful for and write them down so you can remember them. Do this every day, even if it is the same thing. Thinking about this usually helps. Write down questions you may have about things you don't understand or can't make sense of. Spend time in nature. If you have faith practices like prayers, reading, or other traditions, lean on them. Find little things that you can do to help other people in need. It will help you feel better. Reach out to spiritual leaders or mentors who can support you in this way. Many people love the songs they grew up with. Find them and listen to music that makes you feel better. Reflect on how you are doing physically, mentally, and spiritually. Learn what your body needs from you and be willing to try different things to meet those needs. Remember, you are not alone. There are people you can reach out to, like family and friends, support groups, professionals, spiritual leaders, and of course, your healthcare team. Shared joy is double joy. Shared sorrow is half a sorrow.